For our evidence-based practice project, we addressed the question, in the middle-aged population, does the Mediterranean diet in comparison to the Western diet have a greater effect on colon cancer prevention? To start off with, what is colorectal cancer? Colorectal cancer is cancer of the colon or rectum. Many cases of colorectal cancer start with tumorous growths in the lining of the colon or rectum, also known as polyps. About 96% of colorectal cancers are adenocarcinomas. Colorectal cancer has multiple modifiable risk factors and non-modifiable risk factors. Modifiable risk factors can include overweight and obesity, physical inactivity, diets high in red meat or alcohol, and smoking. Non-modifiable risk factors include age, genetic history, racial and ethnic background, and having related diseases of the gastrointestinal tract. Colorectal cancer is prevalent in the United States. The American Cancer Society estimates nearly 100,000 new cases of colon cancer and over 40,000 new cases of rectal cancer every year. It is the third most diagnosed cancer in both men and women, and it is the third leading cause of cancer deaths in the United States. The symptoms of colorectal cancer can include changes in bowel movements, uncomfortable bowel movements, blood in the stool, abdominal pain, weakness and fatigue, and unintended weight loss. There are multiple current treatments available for colorectal cancer. There are both local treatments, which include surgery and radiation therapy, and systematic treatments, which can include chemotherapy, targeted therapy drugs, or immunotherapy. The Western diet is one of the diets we analyzed as our comparison group. The Western diet is high in saturated fats, added sugars, animal proteins, refined grains, and sodium. This diet is calorically dense, but it is very low in nutrients. On the other hand, the Mediterranean diet has a focus on plant-based foods including fruits, non-tropical oils, nuts and seeds, legumes, whole grains, and vegetables. The Mediterranean diet also emphasizes fish and red wine intake. Unlike the Western diet, the Mediterranean diet is low in red meat, sugars, and whole-fat dairy. For this project, we addressed the research question, in the middle-aged population, does the Mediterranean diet in comparison to the Western diet have a greater effect on colon cancer prevention? The PICO question components are as follows. The population, middle-aged adults, the intervention was the Mediterranean diet, our comparison diet was the Western diet, and our outcome was that the Mediterranean diet has a positive impact on colorectal cancer risk. We'll begin by looking at the Mediterranean diet and colorectal cancer, and then looking at the Western diet and colorectal cancer. A prospective cohort study analyzed the colorectal cancer risk reduction associated with high adherence to the Mediterranean diet in over 4,000 participants. It was found that there is an 8 to 11% risk reduction of colorectal cancer when following a Mediterranean diet. Another study found the Mediterranean diet adherence was inversely associated with advanced polyps. Specifically, low intakes of red meat and sugar-sweetened beverages and high intakes of fish and low-fat dairy were associated with a decreased risk of colorectal cancer. Other studies have found similar results. In a study with over 35,000 participants, it was concluded that high, consistent adherence to the Mediterranean diet was associated with a lower risk of colorectal cancer. Looking at the Western diet and its impact on colorectal cancer, a case-control study found that high adherence to the Western diet was associated with increased colorectal cancer risk in both men and women. A small study found that colorectal cancer risk was associated with high red meat intake, which is common in the Western diet. In summary, we gave this evidence a fair grade because some studies were relatively small and all, while they showed promising results, were of grade B or C on the evidence scale. In conclusion, the Mediterranean diet has a positive impact on colorectal cancer, while the Western diet can increase the risk of developing colorectal cancer. High adherence to the Mediterranean diet has shown a decrease in colorectal cancer risk by 8 to 11%. This impact could be due to the high intake of antioxidants and plant-based foods. Also, the Mediterranean diet, unlike the Western diet, is low in saturated fats, sodium, sugar-sweetened beverages, and added sugars. Please see below for our references and photography credits.